Hi friends, this is Soni Thakur and you are watching Agri-bio-tech. Friends, we are back with a new video on COVID-19. Question and answer on coronavirus. So, watch the complete video because we deliver better than anyone else. Before we proceed further, I request everyone please like this video and share it as much as possible. So friends, let's start. I, Soni Thakur, welcome you all on your favorite channel Agri-bio-tech. What is a coronavirus? Coronaviruses are a large family of viruses which may cause illness in animals or humans. In humans, several coronaviruses are known to cause respiratory infections ranging from the common cold to more severe diseases such as Middle East Respiratory Syndrome, MERS, and Severe Acute Respiratory Syndrome, SARS. The most recently discovered coronavirus causes coronavirus disease COVID-19. What is COVID-19? COVID-19 is the infectious disease caused by the most recently discovered coronavirus. This new virus and disease were unknown before the outbreak began in Wuhan, China, in December 2019. COVID-19 is now a pandemic affecting many countries globally. What are the symptoms of COVID-19? The most common symptoms of COVID-19 are fever, dry cough, and tiredness. Other symptoms that are less common and may affect some patients include aches and pains, nasal congestion, headache, conjunctivitis, sore throat, diarrhea, loss of taste or smell or a rash on skin or discoloration of fingers or toes. These symptoms are usually mild and begin gradually. Some people become infected but only have very mild symptoms. How does COVID-19 spread? People can catch COVID-19 from others who have the virus. The disease spreads primarily from person to person through small droplets from the nose or mouth, which are expelled when a person with COVID-19 coughs, sneezes, or speaks. These droplets are relatively heavy, do not travel far and quickly sink to the ground. People can catch COVID-19 if they breathe in these droplets from a person infected with the virus. This is why it is important to stay at least 1 meter away from others. These droplets can land on objects and surfaces around the person such as tables, doorknobs and handrails. People can become infected by touching these objects or surfaces, then touching their eyes, nose or mouth. This is why it is important to wash your hands regularly with soap and water or clean with alcohol-based hand rub. How can we protect others and ourselves if we don't know who is infected? Practicing hand and respiratory hygiene is important at all times and is the best way to protect others and yourself. When possible, maintain at least a 1 meter distance between yourself and others. Since some infected persons may not yet be exhibiting symptoms or their symptoms may be mild, maintaining a physical distance with everyone is a good idea if you are in an area where COVID-19 is circulating. What should I do if I have come in close contact with someone who has COVID-19? In these cases, it is best to stay at home. However, if you live in an area with malaria or dengue fever, it is important that you do not ignore symptoms of fever. Seek medical help. If you do not live in an area with malaria or dengue fever, please do the following. If you become ill, even with very mild symptoms, you must self-isolate. If you do not have symptoms, but have been exposed to an infected person, self-quarantine for 14 days. Follow national advice on self-isolation. What does it mean to self-isolate? Self-isolation is an important measure taken by those who have COVID-19 symptoms to avoid infecting others in the community, including family members. Self-isolation is when a person who is experiencing fever, cough or other COVID-19 symptoms stays at home and does not go to work, school or public places. This can be voluntarily or based on his/her healthcare provider's recommendation. Is there a vaccine, drug or treatment for COVID-19? There are no medicines that have been shown to prevent or cure the disease. WHO does not recommend self-medication with any medicines, including antibiotics, as a prevention or cure for COVID-19. However, there are several ongoing clinical trials of both Western and traditional medicines. WHO is continuously monitoring and responding to this outbreak. For more information, check back regularly on WHO's coronavirus pages. That's it from us in today's video. Subscribe this channel and share this video as much as possible. You can follow us on Instagram, Facebook and Twitter. If you have any doubts and suggestions, you can write us in comment box. We are always here to help you. I am Soni Thakur, signing off. Thanks for your valuable time. Jai Hind.